Hello, I'm Della Schmidt, President and CEO of the Greater Burlington Partnership. Thank you for joining us today. We pulled together this virtual meeting in order to give the community an update on the COVID-19 situation in Des Moines County. With us today is Matt Wenzel. Matt has been the President and Chief Executive Officer of Great River Health since January of 2018. He has worked in healthcare leadership for more than 17 years. His last position was President and Chief Executive Officer of St. Luke's North Hospital, Kansas City, Missouri. Also with us today is Dr. Michael McCoy. Dr. McCoy became Great River Health's first Chief Medical Officer in 2015. An obstetrician and gynecologist, he joined Great River Medical Center's medical staff in 1990 and provided patient care for nearly 30 years. Gentlemen, thank you for joining us today. We're looking forward to hearing from you. We'll begin with you, Matt. Would you share with us how Great River Health is doing? You are the largest employer in our area, and you are on the front line of caring for our community during this pandemic.
Yeah, thank you. I'll answer the question and start with providing context. I always think context is king, and especially in this situation. So we go back to when we first started this in March, and when we established our incident command to address this situation is we defined our mission, and the mission during this time is to protect our patients, employees, and provide fact-based information to our community. And then we said how we're going to achieve this is remain calm. I've been saying from the beginning is that if you're the pilot and run down the aisle, I think everyone else is going to freak out too. So one is remain calm. Two is that we all need to be dealing in facts and know the plan. And three is that we've got to be able to execute upon that plan. So that was back in March. Nothing has changed. We are still going forward with that mission and the way we are handling this pandemic. I will tell you is I couldn't be more pleased with leaders, with the staff, and everyone that are dealing with this pandemic. I think that was back in March when we got the ball rolling. And then fast forward to now, and I want to go over, when I talk about dealing in facts, I want to go over some of those. COVID doesn't care about politics. So we're gonna deal in facts, and we're gonna go over some statistics. Dr. McCoy is going to be able to provide you much more depth than I could about some of the clinical aspects of this virus and how we're dealing with that. And before I get there is that the last time I talked with this audience, sometime over the summer, is we talked about the financial impact. And we saw it at the beginning costing us between $10 and $12 million a month. Then we planed out when we were able to start doing some more elective procedures, and we got back to close to normal. And now, just in the last few weeks, is that we're starting to see this backslide. So I fully expect us to get back. I sure hope it's not $10 to $12 million per month, but I can definitely see us, and we're there now, is we're off $1 million a month, and I can see that escalating to somewhere north of, and I just don't know yet, but north of 5 million, could go up to 10 to 12 million a month. And of course that's importance, but we've been saying from the beginning is that if we don't do mission critical items like phase one that we talked about, protecting our patients, employees, and providing fact-based information to their community, the financial stuff doesn't matter. We've got to do that first. So we've made decisions that will cost the organization significantly, but that's what we're here for. And that's what I want people to know on this call is that we are making decisions that are going to be multi-million-dollar decisions to get back and focus on what we need to do to make sure that we protect patients and employees. So let me go into some of the facts. And I want to start at a macro level and drill down. So across our planet Earth is you look at our country, US, and we've got this is so dynamic, but as of this morning, we had 11.8 million people affected by COVID in our country. And we had, so that's the number one in the world is we got the most COVID patients in the world. And then you go and look at it per rate. So we got 3,500 per 100,000. So we're in the top 15 if you want to normalize it. And then you get to is okay, well, how fast is this thing picking up? Well, we've got 166,000 people per day over the last 7 days that have gotten a positive test for COVID. That's number one in the country. The next, number two, is 34,000. So I think that provides perspective. And then if you want to break that down to a rate, is that we're still in the top 20 of how fast this is growing in our country. So the point there is that for the U.S. is by any indicator you want to look at is we're top 20 in the world as a hotspot. Then you go to Iowa and you look at Iowa and drill down on this is that by about any indicator is that we're top 5 for total cases and also total cases per 100,000, and then also is that over the last 7 days, this thing is growing faster. Again, look at the statistics. I think that we were 4th out of all of the states, top 5 for how fast this thing's growing. And then let me go a step further and talk about our counties. So if you look at Des Moines, Henry, Lee County, Southeast Iowa, is that we're right at the middle for Iowa, which is in the top 4 of the country, which is in the top 20 in the world. Okay, those are the statistics. We got a problem. That's the bottom line here is we've got a problem. And what this is causing for our staff, and I just rounded this morning going up and seeing people, is that folks are fatigued. Is that we've been asking them to do more and more and more because there just isn't staff available. And it's not a Great River Medical Center, a Fort Madison Community Hospital, a Henry County Health Center, all the hospitals in our system. It's not just our problem. This is happening across Iowa. It's happening across the Midwest. It's happening across the country. So we've been telling folks is there's not more cavalry coming in. We've got pretty much what we've got. And we've been asking people to pick up more shifts, and it's going to be picking up even more than we're at today. So staff are fatigued. We don't have enough staff. And Dr. McCoy is going to talk about this in a second, but we are preparing for a doubling of where we're at currently. And this is already the situation we're in, where you've only got a few beds open, period. And again, this isn't just Great River Medical Center or Fort Madison or Henry County. This is the realities across Iowa in this region. I was recently told about a patient that needed to be transferred and couldn't get into the University of Iowa, couldn't get into Quad Cities, couldn't get into Des Moines. We were having to look down even to St. Louis just to get a patient in. And this person wasn't even afflicted with COVID. So I want people to understand is that the problem we're facing isn't just COVID, is it's a saturation of the healthcare system that's causing us to not be able to provide the level of care our country expects And so if somebody has a STEMI, a stroke, a heart attack, and they go to a place that's already saturated because of COVID, they're going to be impacted too. So when we see the deaths at the end of this thing, I don't think what's going to be reported is the true accuracy of what we're going to see. And so that's why is that I'm just going to cut to the quick and tell you that the request we have from our business community and everyone goes back to what we talked about at the very beginning of this thing. One, wear your masks. This thing, again, is turned political. I'm not going to go there, but you look at the facts is that wear your masks. Help us with that. Two is social distancing, 6 feet. And three is avoid large gatherings. And we've seen the governor recently. We've seen CDC recommending that around this holiday season, it stinks, but it's really going to be worse is that if people gather that aren't usually around each other, spread this virus, and then we see a doubling or tripling or quadrupling, who knows where this thing stops, with patients that are admitted, and the saturation that we are talking about gets worse. So because of that is the request is to avoid gatherings around this Thanksgiving season to whom you just come in contact with on a normal basis, which is your immediate family. And then I've been asked so what can we do? What can we do to help as a business community or just individuals? And I just mentioned those things, and that's for all of us. But I want to say thank you to everyone that has donated. We have gotten a lot of donations, and our staff are just very appreciative of that. And so we would continue to ask is that if you feel the need and would like to show appreciation to healthcare workers, and healthcare workers specifically at Great River Medical Center or Burlington or Fort Madison or Henry County, is that they appreciate that. And we've seen gift cards, we've seen people donating directly to restaurant and businesses, and our folks driving through and getting a free coffee. They love that. And then the other thing I would tell you is and I've said this from the beginning too, is that we need the community to shoulder right alongside us with our plan of remaining calm, knowing the plan, dealing in facts, and we all execute on this collectively. And to me, this is a plea for help for everyone on this call is that wear your masks, social distancing, avoid large gatherings. That's the facts. And then also is that we need to be dealing in facts. So if you hear rumors, if you hear things, is arm yourself with information and facts, because especially during this time is if we're not dealing in those facts as a community and rumors get spread and things get rolling, is that it takes away time from people at Great River Health to help dispel those rumors than what we could be doing by providing facts out to the community or providing care into our community. So those are the things that I would say would be helpful for everybody on the call. And I'm going to turn it over, Della, back to you, or Mike, and Dr. McCoy can go through more of the clinical aspects of where we're at.
Okay, thank you for that. And before we move to Dr. McCoy, I want to remind everyone on the call that you can type in a question in the chat feature of the Zoom call, and we're going to be fielding and compiling those, and I'll be creating buckets of similar thought and be engaging Mr. Wenzel and Dr. McCoy in those questions here in a little bit. With that, Dr. McCoy, what would you like to share with the community leaders that are on this call today?
Hello, everyone. I think one of the things I would like to do is just sort of focus a little bit on current state. Once again, just we're going to try to be a little candid with you and just tell you where we're at and give you some of the numbers as best we can. Iowa hospitalization rates and the hospitalizations have doubled in the last 2 weeks. When we started looking at this, they went from 700 to 1,400. Actually, now they're just a little over 1,500. So based on our current census and prevalent rates, modeling would have us to prepare for that to now double again. So Greater Medical Center, for instance, back in our highest COVID census, which would have been back in August, we ran around 20, a little over 20. That was our highest volume. On Monday, we had 39. We're now on surge planning, trying to figure out how we're going to deal with 70 to 80 COVID patients. I can tell you Fort Madison Community Hospital and Henry County Health Center have numbers similar, not the numbers I quoted for here, but they are double now what they were back in August, and they're preparing for the same thing. The United States, the death toll has been its highest as it has been in 6 months, and it's increasing. And we got to remember, those are from positive cases that occurred 2 to 3 weeks ago. So there's a lag time of 2 to 3 weeks from the time we see a positive test until the time we see the hospitalizations, about two weeks plus, and then any deaths soon thereafter. So in Iowa on November 9th, we were running around a 30% prevalence rate. So just go 2 to 3 weeks ahead of that, and we're looking at time frame we're going to be talking about here. The surge is not just due to more testing. There has been about a 30% increase in new cases in the past week, and there's only been about a 10% increase in the test in that same time frame. So a lot of times everybody's saying, well, we just get more positives because we're just doing more testing. And that's simply not the case, and that's not what we're seeing in the hospital. If you go to the Iowa Department of Public Health and the state's website, you'll see the state and the region's number of available acute and ICU beds listed there. Unfortunately, those numbers are just not accurate because it does not reflect the number of staffed beds that are available. So in Region 5, I can't remember how many counties. It kind of goes up from Clinton and down through Quad Cities, Iowa City, over to Tabwinas. We've been having, there's calls that have been happening daily, looking at bed census. The CEOs and the CMOs of these regional hospitals have been in touch with each other to try to help share bed availability information and really what's the staffed acute and ICU beds that are available. And I can just tell you right now, rarely is there an available ICU bed, except at the University of Iowa. And they've maintained about 5 of those that they save, and they're used for a case-by-case basis where they kind of triage those. The university did recently, I think on Monday, just stopping surgical services, and we're opening another 15-bed ICU unit to try to help absorb some of this. So for all hospitals, and when you talk to the different leaders up and down, all in our region, it's the same story. It's like a broken record. We all have a lack of staff. And for instance, Greater Medical Center had an average this week of 82 staff members not at work. Rather, they have positive COVID, they have symptoms, they're being quarantined, they're awaiting results. Today, that number is 97. There are currently 27 staff members at Klein Center that are not at work, which is putting them in a crisis staffing situation in our long-term care facility. So we are at a capacity crisis regionally right now. Region 5 hospitals have all agreed and are preparing for a surge that would be doubling our COVID patient hospital census with limited ability to transfer patients. So what are some of the things that we've been doing here in the last few days? We've initiated our emergency operations plan. We've created a second COVID unit or zone. We have our plan ops people building walls in our hospital over in our acute care area to help create this. We also have walled off part of our ICU. We now have 6 of our 10 rooms by building walls currently in an ICU setting that we're dedicating to COVID patients. We're severely limiting our elective surgery starting Monday, November 23rd, where we'll be mostly doing emergent, urgent, and essential cases. Teresa and the team here COVID operations have been doing a great job of trying to look at where can we get more staff because they're not coming from elsewhere. So we're doing team-based nursing for medicine floors and ICU. We're pulling staff from surgical services areas where we're going to decrease those, and then where we can get them. Teresa's been working with the local nursing schools, looking at students and how instructors can help, looking what retired nurse pools do we have out there, because traveling nurses and CNAs, which we've tried to get what we could, they're just rarely available. Yesterday, all the providers were sent our scarce resource allocation and critical care services policy. This is something that we've had here at the health center for a long time. We dusted it off and updated it for COVID back in March. We fortunately didn't need it, but we now have a concern that we're going to need it. And what that does is it would take and list the tiers of, we're not normal, we're now in tier 2. Tier 3 is really things we don't want to talk about. It's triaging care, and it's meaning that, as Matt mentioned, patients are not potentially going to get the care that they either expect or deserve if we get to that point. Just a quick note on vaccines. Pfizer and Moderna did recently come out, and they have vaccines that are 90 to 95% effective, which is amazing in the vaccine trial world. Emergency use authorization is expected by early to mid-December. What we're aware of is there would be about 40 million doses available in a 2-dose regimen. That's 20 million individuals, or 5 to 6% of our population. And those are first going to go to healthcare workers, first responders, and long-term care facilities. Those will be in a phased-in type fashion. I think it's estimated now that by late spring to mid-summer, the vaccine could be available to the majority of the public. We also have really all the treatments available here that they have anywhere. Unfortunately, up to now, some of those treatments are more supportive than anything else. The monoclonal antibody treatment, we did receive 32 doses under emergency use authorization, and we've been working to get those things ready, and that's actually ready today. So I guess I would just kind of finish, because I know there will probably be some questions, but I would just like to say that, at times I think healthcare workers and leaders have felt like they're talking into an abyss. I think we've been having the same message over and over. An easy way I always try to tell everybody to remember is just stop sharing air. And what Matt said, this isn't political. The virus really doesn't care who you are or what you think. The results are what we're seeing, and if this surge happens as we predict, it's going to be very difficult for us to handle. I think until 70 to 80% of the population is immune, our only things that we can control is our behavior and the ways that we interact with each other. And that's what we have to look forward to, I think, until we get a vaccine and have more immunity. So I'll leave it at that, and I assume then we'll try to address questions as best we can.
So let me thank you. Thank you for being on the front lines of this and working to keep our communities safe. We certainly don't want you to feel like you're talking into the abyss. We're listening. We are coming alongside, and we want to help. How would you advise employers to talk with and engage their employees about the choices that they might be making outside of the work environment? Obviously, employers have done things like improved the cleaning regimen, requiring masks at work, social distancing, all of that. But what are you doing at Great River Health as an employer? Maybe this is for you, Matt, or what would you ask other employers to do in how we are messaging to our employees about what they're doing when they're not at work?
Yeah, so for us is that, and I'll kind of address it in 2 parts, is what we're expecting while they're at work is that, of course, how hypocritical is if we weren't following what we're saying here. So anybody comes into the hospital, is we're expecting them to wear a mask, is that we're setting up social distancing in every one of our conference rooms. Would advise that. So when we do have to have meetings and we don't do it virtually, is we set up environments to accommodate social distancing. And then we're also avoiding the gathering. So really, to me, it goes back to what Dr. McCoy talked about. Until we get immunity, until we get vaccine, is that the behavior is the only thing we control. And it goes back to just the basics. And so for employers is I just continue to encourage your employees to do the things we've just discussed. What I've heard from business owners is that, and it's this paradox is that, we got to stay open and keep the doors, but and then staff are going down. And that's the paradox is that, again, the COVID virus doesn't care if who or the politics or the decisions made, it's just simply getting spread. And so I really feel for all the business community, because what you're getting is a really hard choice of, okay, we need to stay open, we need to do these things, but then it increases chance of spread. So for that is I just would continue to create environments that are as safe as possible so you can continue to operate. Because if, just like us, Dr. McCoy just talked about nearly 100 people being out. I'd be thinking about that if you're a business, and especially a smaller place where everybody, if they work together, is half your staff go out. What happened? So create environments where you are inside your business, and just continue to talk to your employees about the importance of these things outside of work too. And especially coming into the holiday season is I just recently sent out an email to all employees and I made a huge request, and that is to limit your Thanksgiving festivities to your immediate family, because we need you here to take care of our community. And I'd be thinking about some of those things, same things, as if I were an employer, not just employer at Great River Health. So I'll turn it back over to you or Dr. McCoy if you have anything else.
I think the only thing I would add is I know, as I mentioned, we all get COVID fatigue and wonder how long this is going to go on and get tired of it. And who likes wearing the darn masks? And I want to see people and I want to do things back to normal. And we're all there, but we just can't do that, or we're going to pay the price for it. And I think from day one, while this is so fluid, we've tried to say we're going to follow the Iowa Department of Public Health and the CDC guidelines. And while those have been fluid, because this is something new we've never dealt with before, and everybody's trying to figure it out as we go, that's still the best advice that we're trying to use and the best information that we're going to use. And I know it's been confusing sometimes because something will come out and then it'll change and then it'll change again. And that's just part of dealing with a new pandemic that is a new virus. It's got unique things. And as we get more data and find more out about it, some of the guidelines change. And I know that's frustrating, but it's still the best information we have to go by. So once again, I just go back to the only thing we can control until we have that percentage of the population immune is our behaviors. That's it. And everybody knows what those behaviors are. They've heard them over and over again. So I don't think having to say them again is really going to change anything. It's just a matter of us having to do it.
Yeah, we know what we need to do. We just need to step up and do more of it. Well, let me get into some of the questions that we've been receiving. One of them, actually a couple that we've received, is around the question of plasma. Is Great River Health using plasma as a treatment for COVID cases here? And do you need plasma donation from recovered COVID patients in our area? Can you speak more about that?
Sure. So if you look at, we basically have the same treatments here that we would have at the university, except for some very high tertiary care things like ECMO, et cetera. Probably the treatment that has been the most effective is dexamethasone or steroids. Remdesivir, there's a lot of conflicting data out about that. Yes, it's helpful. The WHO just came out and said it really isn't that helpful. It's really hard to know. Once again, you're gathering data as you go, and then you're trying to retrospectively look back at it because you don't have time to do the prospective trials that you would like to do. You want to make sure it's safe, and then you go from there. The CCP or convalescent plasma, yes, we have that. We have used that. Once again, the efficacy of that is somewhat controversial. Currently, the Mississippi Valley Regional Blood Center is out of convalescent plasma. So we had been using it. As of yesterday, I didn't look today, but the supply was out. So for those that are known to be immune or have an antibody, that donating that plasma at Mississippi Valley Regional has been asked for and could be very helpful, yes. And then I mentioned the monoclonal antibody. We just actually have capabilities of starting to use it just today. That's an outpatient, and there's very strict criteria who are eligible for that. Like I said, we have the thing that's a little unusual is we have 32 doses distributed through IDPH, but after that, we don't really know. Are we going to get more? What's it going to cost? Is your insurance going to pay for it? There's all those things that we really don't know, but yes, we have that available.
Okay. And a related but different question is about reinfection rates. Again, there's both Dr. McCoy, Mr. Wenzel, you've talked about let's deal in facts. What are the facts around reinfection? Can people get COVID a second time? And if so, what's that window? We've heard a little bit about 90 days, that you have some level of immunity for 90 days. Is 90 days the magic number? Can you talk to us about that?
So once again, the number is being reinfected a possibility? Yes. There have been a handful of cases in the world of documented patients who have had COVID and then had a period of time go and they got reinfected with COVID. There's been a lot of folks who thought they must have had COVID by their symptoms. It wasn't really documented. Then they got COVID. So just taking on what you can document, there have been a handful, but we're talking about in the world. We're talking about very rare cases. Some of those on reports I've read, a suspicion of maybe a couple different virus strains, a couple they don't really know. We're still learning because really no one is believed to have any immunity, even though this is just one of the coronaviruses. It's not really thought that there's any immunity based on from the others. So I would say the 90-day thing, the CDC has said that if you have had COVID, then you don't need to be retested for 90 days, which most people have inferred means that you're immune for 90 days. I think part of that is we yet don't know if we did an antibody test to see if you're immune or that you have antibody, we don't yet know for sure how to tell people what that means clinically. Are you immune? Do you not have to worry about it? So that there's certainly some unknowns there. I think most of us think that you would be immune for more than 3 months, but I think the CDC has left it at 90 days because they really don't know. I think as you're vaccinated, there will be then more data gathered as we go to find out, is this something that's going to be a yearly vaccine? Would you be immune for many years? I don't think anybody knows that yet. I think that's more data will come because, as I said, we're finding a lot of this out as we go. But the 90 days is related, I think, mostly to the CDC telling us that if we had a patient that was positive for COVID, they come back into the hospital a month later after they've recovered, we don't retest them unless it's been at least 90 days based on the CDC guidelines.
Are antibody tests in your area?
I'm sorry.
Are antibody tests available in our area?
So antibody tests are available. We have an order for them through the hospital. You could have those ordered by your primary care provider. You would have blood drawn, and that would be sent to be ran off at the state hygienic lab. I think primarily those are being used for population health and epidemiology studies. The last numbers I saw, I believe there's been about 75,000 Iowans that have had that test done. About 6% have shown an antibody, if I'm remembering the myriad of numbers right. So the problem with that is here, we're not really using it because I don't really know what to tell for healthcare workers. If one of our doctors comes and says, hey, I'm going to go get an antibody test because it's positive, I'm going to go work in the COVID unit. It makes perfect sense in a disease that we know more about, that we know what immunity means. We don't yet know if a positive serology test showing an antibody means immunity or for how long. And that's part of the problem. We're right now using it for donating convalescent plasma, but clinically it's just not that useful yet.
Okay, thank you for that. I'm going to switch to a couple, I'm going to call them more policy or community related questions and move away for just a minute about specific medical questions. So some employers have a policy in place now requiring a 10-day or even a 14-day quarantine if an employee travels outside the state or gathers with more than 10 people. What are your thoughts about that policy? Is that good? Is that overreach?
Well, I guess I wouldn't be the one to make comments about anyone else's policies that they decide individually that they're going to implement. What we would do once again is we're going to try to follow the CDC and IDPH guidelines. So here at the health center, we would send those people to employee health. They would be risk stratified as to their risk of exposure. It depends on their symptoms, when they were exposed. Are they living with someone that is known to have COVID? What's the degree of urgency of the need to have them back to work? And those are tiered, and then we give them a definition, so it's not just a pat and answer that's the same for everyone. I can tell you though, if you have somebody that's positive with symptoms, or they're living with someone with COVID, they're usually going to be at home for 14 days, but that does vary a little bit. You know, I think the initial travel things made sense when there were hotspots. So if somebody traveled to a known hotspot, and then came back, there was concern about that. Well, now we're the hotspot. So it's hard to find some place that's, you know, I mean, I would almost argue now any place we travel may be safer than we are here. So I'm not sure what the difference would be of having them come back here when we're already a hotspot. That medically I wouldn't understand.
Okay. Matt, what do you need in terms of volunteer work? Is there any capacity or room for volunteers to come in and lift any of the load off of you and your team? Obviously, we can't do direct patient care, but is there something else that could be helpful?
Yeah, and this really is a shout out to Pat Cohen at the Burlington School. Is that district is they asked that same question, and he helped to make volunteers available. So we've got, and Melissa Jones would be a great contact for this. So the short answer is yes, is that we have a need, and I think of right off the top of my head is at the screening stations. And in certain cases is that we've gotten people that could be providing another level of care, but we just got to fill a shift. So that'd be a great example. Short answer is yes. And I think everybody probably knows Melissa is she would be the contact person here at the hospital that can direct those questions to on how folks could volunteer. There's a couple questions I hear, Del, if you don't mind, kind of FAQs. Most of you probably have heard we get paid on COVID deaths. It's not true, period. And candidly, that's just absolutely insulting, is that I go up and round and you look at a nurse who's in Pampers, is in full garb, going into a room, take care of a patient, and to suggest they're getting paid more if they die, it's just ludicrous. And it just has to stop. And so there's no validity to that. Now there is truth that we get paid more based on a COVID diagnosis. Here's the problem is that with that argument, we spend more taking care of that patient based off of the needs of that patient. Dr. McCoy just talked about going and retrofitting rooms. You look at staffing ratios. You look at all of what we need to take care of these patients. So here's the truth. We lose less money per patient because we get a little bit more because of a COVID diagnosis. So we get the opportunity to lose less money. We're still losing money on patients that have COVID diagnosis. So if people can help dispel that rumor too, it's absolute garbage. And I hope that you hear my voice, and I'm representing all the clinicians up there that are taking care of the patients. Is it's just insulting. The other thing I want to talk about is we made a change a few months ago, and we responded to what we were hearing in our community. We were the first in the state of Iowa to set up this public-private partnership with Test Iowa, and can't tell you how much difference that's made in our community. And I suspect many people on this meeting have or know of somebody that have gotten tested through Test Iowa. Last Monday, we saw we saw 738 people be tested in one day. And we're seeing rates coming out of that at 25% positivity rate. So again, there's just more facts on why what we're saying to do, and we need help because we're saturated as a healthcare system. There's just more statistics for you. So what we're averaging out in the month of November is over 500 people per day getting tested through Test Iowa. And I couldn't be more pleased with the staff over there. The longest wait that people are having to get, so on this 738, most we've ever done in one day is that reported to me was the longest somebody had to wait was 45 minutes. Generally is if there is a wait, it's anywhere between 15 minutes and 30 minutes. So on these 500-600 day testing days is people may have to wait 20 or 25 minutes. And so I just complete compliment to the staff over there. And that would be another way of just when we're going to have more people go through this, is just to compliment the people that are providing that service to us.
Adela?
Yes, sir.
If I could, I would just share with you one very common question that seems to be asked. And it's, hey, if we just have to all get immune and get through this, why don't we just all go get infected? A lot of people don't get that sick. A lot of kids, it doesn't really bother them. Let's just all go get infected and then we'll be immune and we can move on. And I think that would be an incredibly dangerous mentality for various reasons. The herd mentality thing, the projection of numbers of deaths that we would see, and the overwhelming of the healthcare system to get to a herd mentality would be numbers that no one would want to even think about. And then number two, my biggest fear is we don't know the long-term effects of this virus. It's a brand new virus. We know there are some viruses that you get it and you're done. We also know there are some viruses out there that you get it and parts of it stay with you forever. And so we don't know what you may be at a higher risk for a year from now or 3 years from now or 5 years from now, because we don't know the long-term effects of this virus, and we won't for some time. That is the fear of let's just go get it and get it over with. So.
Thank you for that. That actually brings up a couple of questions that I've seen in the chat. Would you care to share any thoughts that you might have regarding in-person education?
I'm sorry, in-person education?
K-12, higher ed, how are we doing with our in-person education?
I'm glad I'm not Pat Cohen. That's what I'm glad, I see the value in the socialization and kids being kids and is it better to learn in person than I get all that. I understand it. I'm glad I don't have to make that decision, because I don't know if I can tell you what's best. I can just tell you that the kids, though, do bring it home to their parents, or they do bring it home to their grandparents. And while they may not be as sick, and as we all know, up to maybe 30% of us could have it and be asymptomatic. So, the education system, I let the experts to that figure it out, but I can just tell you that the kids in school will bring it back, and they will bring it back to their family members and their grandparents. It's that simple.
Okay, thank
I'd
you.
also add is that if you look at 15% of what our educators are dealing with, that's an arbitrary number. Is there's not science backing whether it's 15% or what the number is. And I just double down on what Dr. McCoy said is that I suspect everybody on this call is having to make difficult decisions, and that's one of them. That's a hot potato that is it better to be in person and learning? Absolutely. Is it going to cause the spread of coronavirus, and does the risk go up? Absolutely. And so to balance that out, that's the question. And is there a magic number? No. I mean, really, I guess it's zero. But until we get to that number, I mean, there's some states. I saw a report yesterday where they're talking about 3% in New York City. Again, if you look at our rates, we're well in excess. I mean, we're getting to a point where we're 8, 9, 10 times that in certain regions in Iowa like ours. So that one's a difficult one, but those are the facts that we're dealing with, and then the balance is the answer, which is really tough.
See, Matt, I want to ask you a question going back to staffing. Again, as you mentioned, both of you have mentioned, there's concern about what case numbers may look like over the next couple of weeks. Have we crested, and are we coming back down, or are we still climbing? And is there any possibility of bringing back staff members that you had to lay off earlier this year because of finance problems? Is there any possibility of state or federal dollars coming into play that would make it possible for you to bring staff back? Or were the staff that laid off not the individuals that you need for managing this pandemic? Can you share any insights on that?
When we did reorganization earlier this year, it was really around leadership. So it had nothing to do with direct patient care. From a state or federal level is that we're dealing with a staffing shortage as a nation. And so we're really focusing on what we can control and not hope is not a good strategy. And we're not hoping that somebody's going to provide us staff at a state, federal level. Is we're controlling what we can control. And Dr. McCoy mentioning earlier about, and I'm a fundamentalist at heart. Is what go back to this: is you either decant the work and shift it to other people to take care of that, and that's what we're looking at when Dr. McCoy mentioned about team-based models of care. where we could spread our nurse to patient ratio greater by decanting that work and moving it down the line so we can do team-based approach. This is a common occurrence across the industry at this time right now. So most people are looking at this, or should be. And then two is that are there ways that whether nurses, how do we get more staff? And how do we get more staff means that, like Dr. McCoy mentioned, is that we made a conscious decision to stop doing elective procedures in the OR because we could shift those nurses. It's a staffing issue. And so we can shift those nurses over to help out in our most increased volume areas. Those are what every hospital either is or should be looking at doing. But the third option of just hoping that more nurses are going to be coming in, again, hope's not a strategy that I'd want to deploy in this time.
Thank you. Well, I've got one final question and then we're going to wrap this up. And it's a mental health question. What can employers, what should they be aware of regarding the potential mental health impacts of COVID and their employees? We know that there's the fear and anxiety. There's the concern about if I get sick, am I going to be able to financially afford to be off for an extended period of time? And then there's just this, life is so not what it used to be, and we're not able to have the social scene and the fun, and it's draining and exhausting, and the whole COVID fatigue is real. What can employers do to help their employees with just this overall mental health issues that COVID-19 might be causing?
So maybe I'll start, and Dr. McCoy, you hand it off. You're going to be a lot more able to answer from a clinical perspective. But what we've been talking about at the hospital it's the Stockdale Paradox. And if you've not heard of it, I'd Google it. Admiral Stockdale, and actually it's close to home. This guy who lives in California now grew up in this area. And I think it was over by Galesburg. So he's got some local ties here. And he was captured, POW, and was asked who survived. And he'd say, the optimists, they didn't. And it was because they always looked at hope, and then they thought, okay, well, we'll be out by next week or next month. And that never happened, and then they just lost hope. Pessimists couldn't, because they could never see hope. They never thought that there was going to be an end to this. And he said it's the paradox, is that those that didn't lose hope, but they could face the brutal facts. And that's what we've been trying to do here at the hospital, is not promising people when this thing's going to be over, because anybody doing that does not know. So we got to face the brutal facts, but we can't lose hope, and we have to have resolve. And as business leaders, is that we have to provide that groundswell and that hope for our employees, but not just lie to them and not just provide things that aren't factual. We got to look at the brutal facts while still having resolve for the future. We will get out of this. I can't tell you when. No one can. We don't know what it's going to look like at the end, but we still have to have resolve and hope for the future. And if you lose that, just like Admiral Stockdale taught us, is that those are the people that are going to be extremely afflicted. So from a general perspective I would encourage everyone to be looking at the Stockdale Paradox, and it really goes around resiliency. And we need that during this time. As far as specifics, I don't know if Dr. McCoy, if you have anything to add.
I think everybody struggles, and everybody is struggling. I think I'm without knowing numbers, I'm sure our employee assistance program has been busier than it has been. and utilizing the resources you have in that way, which are already stretched thin. But I think it just goes back really to what Matt said is, I'm going to suspect most of the people on this call are leaders in their respective organizations or businesses. And I think in saying it in a different way that Matt did maybe is just be a leader. And if you're a leader and try to help show people you care, be part of a team, let them know that what they're doing is mattering, that you understand them, be empathetic with them. I think that goes a long way. And sometimes we've talked about that here. We get so busy with what we've been doing, trying to figure out what's coming at us and how to deal with it, that we lose sight of the fact that we need to get out on the floors and go visit with those that are on the front lines and let them know we care about them and we appreciate them. And that makes a huge difference. And I can just tell you that I've seen people step up and volunteer and want to be part of a team and do things much outside their comfort zone because they're just stepping up. And if we don't step up as leaders, no one's going to step up behind us. So.
Well, gentlemen, I want to thank you for spending so much time with us today. I want to thank all of those that are watching via Zoom and live on Facebook. I know we have an audience of over 150 people. There is a very high level of interest and concern in this topic. I believe our big takeaways today are not to grow weary in the mitigation efforts that we're taking. For those who maybe have not been taking this as seriously as they need to, now is the time to step up. We must get our numbers down in order to keep our businesses open, in order to keep our students able to have some form of normalcy in school. And maybe just as importantly, or most importantly, we need to make sure that we're not overwhelming our important Great River Health system that's there to take care of all of us. So again, gentlemen, thank you for your time. Thank you for those that are on this call. The Greater Burlington Partnership is going to continue to work with business leaders and city, county, and other leaders in getting out a community message, and we invite you to be part of that message. We can't do much about the rest of the country or even maybe the rest of the state, but working together, we can make it better in Des Moines County. We can drive our numbers down. We just have to do better. So, gentlemen, thank you very much for your time. We so appreciate it, and we'll be back in touch. And with that, we'll conclude today's Zoom call.